Okay, here are my 5 audience members. The 3 Stooges as well. So, diabetes management. So, when many hear needles or injections, people freak out or cringe. Now, imagine being diagnosed with diabetes. The first thing to mind possibly is injections of insulin. Now, diabetes does require a set of tools used in order to control one's blood sugars. Now, I will be discussing how to manage diabetes by checking blood sugars, medication, diet, and lifestyle. Now, starting off with the popular diabetes type 1, typically consists of your body not producing enough insulin. Now, onto diabetes type 2, that's usually due to your body making or not using the insulin properly. Now, effective tools to check one's blood sugar come from a glucometer. So example I do have here is the glucometer, and it also features a lancet that's typically inserted into this pen-like device. And then typically, of course, you prick your finger and then onto the test strip. So typically the test strip is inserted into the glucometer, and then wherever you picked your blood, or you pricked, it absorbs it and it gives you the ultimate reading and overall of your blood sugar. Now, typically, once you're given your overall blood sugars, you go to your doctor creates a plan based on your readings and provides the proper follow-up care needed. Now, typically when one takes their blood sugars, they take them in fasting, and typically also 1 to 2 hours after eating a meal, all depending on what doctor prescribed. Typically that is the case. Now that we have discussed blood sugars and one method to control using the glucometer, we go on to medication. Now, meds are required for type 1s and type 2s. Type 1, the insulin is used to make sure they're keeping the sugars from being too high or too low. Now, on what's called verywellhealth.com, it gives you a list of insulin. So there are many types. Some popular ones are actually rapid acting. Now, rapid acting acts quickly, typically by allowing the sugars to not rise too high or too low. Now, there's also something that's called short acting. Now, short acting, you take about 30 minutes before a meal, and it helps it also in maintaining your blood sugars. Now, it's also used with what I'm about to go number 3, long-acting insulin. Now, long-acting insulin can be combined with short or rapid acting, but typically it's used to lower your blood sugars when the rapid acting has stopped working effectively. Now, onto type 2. Oral type 2s typically need oral and or insulin as well. Now, a popular oral medication that's used is metformin. Metformin usually is given due to the slowing down of the production of glucose in your liver, and it promotes your body to use your insulin effectively. Now, insulin is typically used as a last resort. So if one really needs it and the oral meds are not working in itself, then that's when insulin will come into play. Now, now that we've talked about meds, off to kickstart, the next best thing will be diet and a healthy lifestyle. Now, these tools are essential and needed to also control one's blood sugars. Now, how, you may ask? One is by making correct food choices. An example I do have here, it's from the ADA website, the American Diabetes Association. It's called Create Your Plate. Now, this Create Your Plate gives you a plate with options. Typically, for a diabetic, we should be having half of the plate of non-starchy vegetables with fruit, and the other half is usually split into quarters with your serving of your starch and your protein. Now, example of healthy food choices, example with starches, we want whole grains. So you can still have your rice and your pastas, just mainly more whole grain. low calorie food items, low fat items such as dairy products, and of course, plenty of water, right? Now, being active also helps in achieving a healthy lifestyle. So, it's also used to manage blood sugars. Now, according to the National Institute of Diabetes and Digestive and Kidney Disease, taking a 10-minute walk 3 times a day is a great starting plan. Basically, it's going to make a huge difference in glucose control. It doesn't seem like much, but it does make give an overall effect. Now, the ADA also on that website, it does give you tips and activities besides walking as part of the lifestyle. Example, aerobic training, so swimming or strength training such as lifting weights or resistance bands, and flexibility such as yoga. Now, in all, given the right tools, a diabetic can manage their blood sugars by, of course, checking them using the glucometer, the proper medication needed, and as well the diet and lifestyle changes. So I hope that all the tools I just mentioned can help a fellow loved one or a friend that having diabetes does not mean one is defeated. Managing to give a custom plan by your provider can manage your sugars. It's all about change. Now, if a diabetic can do it, why can't we have a healthy lifestyle change and kickstart our changes for future? Thank you.